Hey, this is the Skeletal System Disease Project over Ewing's sarcoma by Michael Fabiano. A general overview. What is Ewing's sarcoma? Ewing's sarcoma is a malignant, small, round blue cell tumor. It has a history for being a rare disease. Ewing's sarcoma can affect any bone, however, it usually affects the long bones, such as the femur, tibia, and humerus. The bones of the pelvis are also often affected. Ewing's sarcoma affects the body as it is a cancerous tumor that grows in bones or soft tissues near the bones. Causes. How is the disease transmitted? There is no known cause of Ewing's sarcoma. Most cancers are known to arise from a certain kind of tissue or organ. However, in the case of Ewing's sarcoma, doctors do not know the exact type of cell in which the cancer starts. Incidence. How many people does this affect? Each year, roughly 225 children and young adults in the United States are diagnosed with Ewing's sarcoma. The disease is most common in male children and young adults. The Caucasian race is at a higher risk for developing Ewing's sarcoma than African Americans or those of Asian descent. The mortality rate of Ewing's sarcoma varies by age. The 5-year survival rate for a child under 15 with Ewing's tumor that has not metastasized or spread is about 78%. For children and teens aged between 15 to 19, the 5-year survival rate is 60%. Totaling around a 70% survival rate between all age categories. Common indicators. What are key signs and symptoms? Because most cases of Ewing's sarcoma are in teens and kids older than 10, it often goes unnoticed or misdiagnosed as growing pains. Pain at the tumor site as well as swelling or warmth are common symptoms. The pain may be worse during exercise or at night. A tender lump may form in the affected area a few weeks after the pain begins. Diagnosis. What tests are needed? To diagnose Ewing's sarcoma, a doctor will do a physical exam, gather medical history, order x-rays, an MRI, or bone scans to find a change in bone structure. A tissue sample must be done for a diagnosis as well. When a doctor does this, he or she will use a long needle to take a sample of the tumor. Treatment. Is it curable? Treatment for Ewing's sarcoma depends on many things such as the size and location of the tumor, and whether the disease has spread. Most patients will undergo chemotherapy to kill cancerous cells and shrink the cancer before surgical removal. Chemotherapy is also given after the tumor is removed to help ensure the cancer cells do not come back. Chemotherapy, radiation therapy, and surgical removal are the only known cures for Ewing's sarcoma. Prevention. Can this disease be prevented? While it is always good to maintain a healthy weight and to quit smoking or using tobacco, currently there are no known lifestyle changes that can prevent Ewing's sarcoma. We're excited.